to the Healthcare Planning and Infrastructure Expo Conference 2025. Time now for Panel 7, Integrating Digital Health Technologies into Infrastructure. Dr. Rahul Singh Amritraj, Head, Center for Medical Innovation, Government Institute of Medical Sciences, GIMS. Give them a big round of applause, everyone. Welcome all the panelists. Now we are starting with the panel.
Hi, my name is Dr. Vishal. I run a BIORx Venture Advisors, which is basically an investment banking firm, and we also have a network of angel investors for healthcare. This is called Indian Healthcare Angels, and we love to start and support startups in this area. Be it except the hospitals, as an angels, we do everything. And digital healthcare is one of our favorite sector, and we have committed to almost 20 plus companies. And that's one reason we think we are suitably placed to be able to contribute to our thought leadership today. Thank you.
Hi everyone, I'm Dr. Rahul Singh and I represent Government Institute of Medical Sciences. And here for a special reason that Government Institute of Medical Sciences is not just UP's but country's first public hospital-based incubation center. We have an incubation center, a medtech center in the public hospital, and we are also a Stanford Biodesign Center. So we'll talk more on it as we go forward. Thank you.
So welcome both of you. We all know, at least in the last so many years working in healthcare sector, there has been a sea change in the way we perceive digital health and use of digital technologies in healthcare provider system as well as the rest of the ecosystem. For a long time, and in fact even now, a lot of organizations still think that digital technologies and the IT department is a service in the hospital. But the way we see that the hospitals cannot function without adequate use of digital technology. There is a time, I think, has come to really shift our mindset to think of it as an infrastructure. Now, I want to actually ask both the panelists that do they think that the time has come?
See, we have to understand at the pace at which India is changing, the definition of service and how does a service change into an infrastructure is rapidly changing. Had it been that this was 2015 and not 2025, all the techie thing in the health were only services, more of a SaaS model. But now, if you don't have a good HIMS in the hospital, you're not able to perform better. Slowly, these services have become a sort of very important infrastructure. So that is where my take is. Then we need to invest more and more, and the definition of infrastructure is not just physical. This digital infra is playing an important role. If you talk about the way healthcare is changing in terms of AI getting into it, whether we agree or not, but AI has taken up. Whether it is clinical decision making, whether it is data-driven model making, machine learning. If you don't have a good hospital digital system, we will not be able to compete with the world. We are competing with the world because now we have realized that it has to be good with the service and it has to be an optimum quality infrastructure as well.
Yeah. So it's not just about competing with the world, but also to improve our own benchmark as we go. I mean, if we are the leaders, you stay leader because you improve your own benchmark. I want to have Vishal's views on, because he comes as an investor. So how do you perceive the way digital technologies have to be adopted in the healthcare system? And what do you look for in any healthcare provider system or a digital technology system if you have to put your money in it?
Thank you, Dr. Uma, for this wonderful question. I think this kind of question can be answered through many PhDs. And I will still not be very perfect, but I'll attempt the answer. So I think infrastructure, IT, I think they are very well correlated. Today, I remember when we were funding hospital like Medanta in 2007, and we appointed 5 consultants and we did techno-economic viability report. And one of the line item was medical equipment planning. But what has really changed from there to now, I see there is a planning of digital health technologies. Now, digital health technology is nothing like a luxury. It is actually a very, very integral part of any hospital, because hospitals are supposed to be regulated businesses, and there is always going to be a challenge to be defending something called for NABH accreditation, for ESG compliance, for many other regulatory things like even biomedical waste management. Now, unless and until you don't have I would call it like a ERP for a hospital, which can give you a complete snapshot that how well your hospital is being managed. And one of the roles of the CEO, if you look at, most of the hospital CEOs are not coming from a healthcare background. I think they may have a probably MBA in healthcare, but they may not really have an MBBS degree. So how do we ensure that they run a sustainable healthcare organization? And that can only happen when you really look at the metrics, right? And one of the metrics of a hospital is return on investment. And I think today the RBI recognizes hospital as an infrastructure status. And like the way infrastructure bank financing happens, the healthcare financing also happens the same way. When I was working with Dr. Trehan and we were looking at funding him, I think there was never a time where he said that, give us some moratorium, but we, from our side, we think that probably it will take time for him to be able to scale up from 500 bed to 1500 beds. But trust me, within 9 months, the hospital became EBITDA positive. The occupancy went from 15% to 45%, which is incredible for 1500 bed single multi-specialty hospital. Now, I think all this could happen because he planned it very well. And I felt that we were looking at cyber knife. I think one of the Dr. Anshuman spoke about robotic surgery. I think Dr. Trehan in 2007, when he was thinking of setting up a hospital, he said, I want something called CARM or something for precision oncology. And that's the kind of vision, because he went to a hospital in Singapore and he thought that that's the kind of technology we should be able to bring in here from an accessibility point of view. So technology is not only medical technology, it's also healthcare technology. So I think gone are those days where people have to think about only medical equipment planning. Now it's about IoT. It's about wearables. Now all the data is actually technically tracked through what? Gambit, Ring. So I think that is where technology is not an option anymore. Technology is a hardcore part of infrastructure to be able to create value at the last mile. Talk about healthcare at home, right? Home healthcare actually is so powerful tool. Today, a lot of us actually don't want to go to the hospital, because we think that there is a secondary infection. And because, there will be a secondary infection, your output and outcomes are not even sure how it is going to be. So I think the technology really enables each one of us to be more accountable and let the infrastructure of a hospital be used for people, those who really need it, because this country still lacks the number of beds. It really lacks the number of doctors. So I think the technology can enable the best outcome, and in management we call it resource minimization and output maximization. And I think this is where I want to say that technology will and technology has, and it will continue to play a very pivotal role in bringing transparency, affordability, accessibility to the entire healthcare continuum that we are aware of. And I think digital technology continues to play a very important role. And that's when, we have invested in every aspect of healthcare portfolio from a healthcare continuum perspective. But adoption is still a challenge. And this is where, I think we will continue to interact with stakeholders like you, since you will be running a hospital, why the technology adoption, is not adopted the way it should be. And this is where probably I think there should be a good learning among all of us today. Thank you. I think it was a long answer, but I really wanted to reflect on what my experience has been for about 15 plus years across all the healthcare value chain. Thank you.
So thank you, Vishal. And taking from where you left about challenges of adoption. You see, we are right now, we understand that healthcare delivery is nothing but management of data. We have delivery of healthcare is nothing but analyzing data from the patient, investigative reports, and then doing treatment. Now that we have newer tools for data acquisition and data analysis, there is no doubt, I think, in the people sitting here, that we need to use digital technologies because of improvement in care through process efficiencies. But why is there a challenge of adoption? Where is the mindset of, as I said, from surface to infrastructure? What is it that is preventing us for, when we build a hospital, we know that hospital बनाना है तो building बनानी है. तो hospital में अगर आपको patient को treat करना है तो you have to put your networks, put your IT systems, put your software as part of that infrastructure. Why is that mindset not yet there?
मैं इसको बड़ा अलग तरीके से देखता हूँ. एडॉप्शन बहुत स्लो है. गांधी सबसे बेहतर कोई नहीं बताएगा. वी हैव मेट एट डिफरेंट प्लेटफॉर्म्स. बट यू हैव टू अंडरस्टैंड वन थिंग. हेल्थ केयर डिवाइसेस और सॉफ्टवेयर मेडिकल डिवाइसेस और डिजिटल टेक्नोलॉजी में जो भी मेजर जिसमें इंटरवेंशन है या जहाँ भी क्लिनिशियन इन्वॉल्व है, उसमें देयर आर लॉट ऑफ प्रोसेसेस एंड प्रोटोकॉल्स. दीज आर वेरी वेरी टफ, नॉट दैट ईजी. इसीलिए आप देखेंगे कि देयर आर टेक्नोलॉजीज, दे हैव डिफाइंड अ डिफरेंट टर्म, वेरेबल टेक्नोलॉजी, or there's something they do not want to get into that term of medical device. ये जो एक तो processes are very tough, we need to have better, मैं ये नहीं कहता हूँ कि processes को कम करना चाहिए, but then we need to have more infrastructure and support mechanisms जहाँ data मिल पाए. For example, at our government hospital, we have around 25 plus startups. कुछ हमारे पास आते हैं कि हमें data दे दीजिए, पर data देना पेट्रोल खरीदने की तरह नहीं है कि आप हॉस्पिटल में गए, 500 का चेक दिया और पेट्रोल ले लिया. डेटा जब जनरेट करते हैं, एनी डेटा जनरेटेड एट द हॉस्पिटल इज ओन्ड बाय द हॉस्पिटल. एक पब्लिक हॉस्पिटल में एक बहुत बड़ी जिम्मेदारी होती है. बट देन देयर आर प्रोसेस, वी कैन राइट पेपर टुगेदर. उस डेटा से जो एनालिटिक्स निकलेगा, दैट कैन नॉट बी शोल्ड आउट. अभी डेटा में कोई स्ट्रॉन्ग पॉलिसीज नहीं है हमारे यहाँ. वी नीड टू हैव टफ पॉलिसीज. मैं हमेशा कहता हूँ रेगुलेटरी हैज टू बी टफ, क्योंकि जो हम कहते हैं ना कि इंडियन डिवाइसेस FDA क्लियर नहीं कर पाती, लेकिन FDA क्लियर डिवाइसेस इंडिया में आ रही है. मेडिकल डिवाइसेस में 95% एंड अबव हम बाहर से इंपोर्ट करते हैं. जो हम यहाँ बनाते हैं उसको अडॉप्ट नहीं करते. उसका रीजन है कि वी नीड टू मेक इट विद द क्लिनिशियंस. अभी होता क्या, वी मेक इट एंड वी सेल इट टू द हॉस्पिटल एंड दैट गेट्स, एंड देन वी वांट डॉक्टर्स टू एब्जॉर्ब इट. ऐसे ही होता है. हॉस्पिटल के ओनर ने कोई सामान खरीदा, डॉक्टर्स को बता दिया कि हॉस्पिटल में नया इंस्ट्रूमेंट आ गया है, आपने यूज करना है. अभी वी आर ट्राइंग, लेट्स को क्रिएट विद डॉक्टर्स कि क्या हम साथ में मिलकर कर सकते हैं, क्या हम कोई पेपर साथ में लिख सकते हैं, क्या जो इसका एनालिटिक निकल कर आएगा हमारे साथ में ओनरशिप होगी. जो हम IP निकाल कर लेके आएंगे डिवाइस बनाने के लिए, विल शेयर दी IP. जब इस तरह का फेथ डेवलप होगा तो प्रॉब्ली विल बी इनटू अ बेटर शेप ऑफ एडॉप्शन. अगर हमारे हॉस्पिटल में आपने कुछ करना है, आप कहोगे डेटा दे दो, दूसरा आप आगे कहते हो कि हम हॉस्पिटल के साथ मिलकर करना चाहते हैं. इस दोनों के अप्रोच में फर्क है. बेटर रेगुलेशंस आर इंपॉर्टेंट, और मुझे लगता है कि वी हैव टू क्रिएट अ विन विन कंडीशन. और उसमें एक ही तरीका है, आयुष्मान भारत मिशन जो गवर्नमेंट का है, ABDM. एंड कैन यू इमेजिन अ वर्ल्ड अगर जो कोविन ऐप नहीं आया होता. एडॉप्शन हर जगह होता है. कोविन के वक्त एवरीबडी हैड अ कोविन ऐप. क्राइसिस में आपको लगा वो जरूरत है. वी डोंट नीड अ कोविड टू टेल अस कि हमेशा ऐसा ही कुछ चाहिए. बट एडॉप्शन विल इंक्रीज, उसके एडॉप्शन और बढ़ेंगे. बट देन वी हैव टू को क्रिएट एंड वी हैव टू हैव बेटर रेगुलेशंस विद मैकेनिज्म टू हेल्प. दैट्स माय टेक.
Yeah, so I actually couldn't agree with you more that most of the digital technologies that have been made available to us has been developed by technologists in silo with very limited input from the doctors, nurses, technicians or other stakeholders in the healthcare ecosystem. This has for the large part been responsible for non-adoption, and I fully agree with you there. But what is also important is to know that the government has policies where now they are testing for interoperability of different software for various devices. They have good data protection at least whatever there is a step in the right direction and moving forward. Now you invest in, so you invest in a lot of digital technologies and you've been doing this for the last, I think, more than 15 years. I want you to tell us whether what Rahul has a concern that the input from the direct healthcare providers or the patient community has been very limited. Is that changing? That landscape, is that changing? And do you see that it is changing in the right direction or we are still groping in the dark?
No, I think it's changing. I can tell you, like we used to see presentations in presentation. they would be only slide of problem statement and then the team and nothing. But today, when we see, we look at, they have a scientific advisory board. They've got a clinical advisory board. And then they're saying that a product or a SaaS, like a product, like a software as a medical device, is being tested and clinically validated. I think from where we were 10 years back, where people would not even care about, why should we look at clinical advisory board. Today, when they come to us, I think 9 out of 10, they actually have all these pillars to be able to give us a confidence that there is a need. Of course, we will do our own commercial due diligence, for which we have access to people like you to help us validate that problem. But at the same time, I think there is a lot of improvement. And today I see that it is not a pull effect in startup. There is actually push effect. But this push effect is slowly creating a pull effect, because there are times, since I represent Angel Network also for healthcare, doctors are actually leading the investments. They are saying that this is the right problem and I am going to be the first user. Can there be a better technology than this? 2 deals that we have recently done, I'm very proud to share that I've been venture building a company called Seva Mo, and we've really done a lot of phenomenal work for them. But one thing we could not really do is to really help them with the funding, because we felt that they're still trying to build whatever building. They may not really need a equity funding. But the moment we understood that their AI layer is so important for primary healthcare screening, and the kind of social impact that they created was so phenomenal, and I was able to not lead, but I was able to trail. But the doctor from one of the pedigree doctor from India, everybody knows him, Dr. Ravendranath, who sold Global Hospital. It didn't take him much time to sign off the deal, right? This is one deal I'm talking about, that, where doctors are actually saying that we want to invest in such companies which are solving a problem of a scale and thereby improving the adoption. The second I can talk about is the robotics, right? Now, we all talk about robotics, everybody's talking about Da Vinci, but can everybody afford Da Vinci? We don't know. But can there be a specific robotic interventions for particular organ, like for example for GI? Now this particular company, where we have not closed the deal, well, we have closed the deal but we have not announced it, but we're very proud to tell you that it's like a very equivalent product of Da Vinci, but solving a problem for gastroenterologists, and a very good product, and we feel it actually has a potential to be unicorn, from India. And could somebody think about robotics? And who's funding this company is a doctor and a medtech entrepreneur, because they know, is this a real problem? Yes, it's a real problem. Can they solve it at a scale? Yes, because the medtech entrepreneur who's funded them, along with us, is identified and actually validated the problem. So I think this is how we see that, the environment is getting better and better from an adoption perspective. Because when the stakeholders are aligned, you will see that the synergy will happen. And when the synergy happens, that's where the impact happens. And I think this is what we are very excited about. I am particularly sure that in next 5 years, we will see almost all the departments, right, of a hospital not only talking about HIS, but they are talking of some specific module that will create a lot of data analysis and the intelligence for them to be able to be very effective in their own specialty. And I think this is what we are not thinking about 5 years from today, but we already see solutions, but adoptions will take time. But we are very, very excited about this digital revolution which has taken place. And I can tell you, this is where we will be surpassing even countries like USA. And I think Dr. Anshuman did speak about that, he's doing robotic surgery here, and how he's been asked by the Germans that how you are managing it, because we have that expertise which probably they didn't have it. And I think this is the confidence that we carry in Indian healthcare today, that startups can respond to and they will win eventually.
Yeah. So although I do agree with you, and I know that we are trying to telescope our growth quickly with so much of convergence of so much of technology that is being developed, we have a lot of islands of success, undoubtedly. One of the things which I am going to now ask both of you is about the talent pool that is deficient to make this happen and fast track this, and especially Rahul, because you are a CEO of a healthcare organization. There are new job cadres that have developed, and nobody is really paying attention to it. agreed, when doctors are at the forefront of this change, anything in healthcare, that's a big force multiplier, we know. But doctors alone can't make this change happen. You need to have people working in the ecosystem. We have not even gone at a national level to identify the skill sets that are required to make this change happen, to identify the job cadres, to create those jobs. I mean, how many people? Today, you need a data scientist, data analyst for the hospital. You need a digital healthcare team for a hospital, which will be about 10, 15 people for about 500 beds. Have we even looked at it? So unfortunately, Gautam is not here. So now you are proxy for Gautam, okay?
Okay. So very rightly said, ma'am. See, skill set for something very new sort of thing. For example, well, I'll talk about the incubation center which we run. At GIMS, we have very recently started something called SETU, Skill Enhancement Training Unit. Suppose that we believe that at the government hospital we have everything. We get good people, whatever we want. But then if somebody wants to upscale, and that skill is required, but वो officially अब college जाके नहीं सीख सकता 3 साल लगा के. तो हम लोगों ने एक module निकाला हुआ है where one can actually come in, ICU में train होना है, under the guidance of the clinician. We need, I believe, इस तरह का model और होना चाहिए country में, where you actually get into the system, work there, learn the business, upskilling के लिए ना you have to work in this system. तभी, क्योंकि हम मुझे और आपको जो मैन पावर चाहिए, मुझे मेरे इंक्यूबेशन सेंटर में ऐसा मैन पावर चाहिए जो बहुत पॉलिश्ड हो, या फिर बहुत मेहनत करनी पड़ेगी. तो कैन वी रन स्मॉल प्रोग्राम्स? देयर आर गुड सेंटर्स लाइक वेंचर सेंटर, वो एक प्रोग्राम रन करते हैं 2 दिन का. कैन प्रीमियर इंस्टीट्यूशन इन द कंट्री, जैसे हमारा जिम्स भी है या और भी लोग हैं, कैन दे रन कोर्सेस? क्योंकि वो रन कर सकते हैं ऑटोनमस इंस्टीट्यूट्स. वहाँ से स्किलिंग 3, 4, 5 दिन में ना जो इंपॉर्टेंट स्किल वो ब्रशअप हो जाता है. वी नीड मोर एंड मोर दीज सॉर्ट ऑफ अपॉर्चुनिटीज बाकी लोगों के लिए, जहाँ लोग अप स्किल करें और एब्जॉर्ब हो जाए. तो जो हेल्थ सेक्टर काउंसिल का पर्पस है ना प्रॉब्लम, तो दैट इज व्हाट इट इज.
See, there is 2 kind of population of healthcare workers. One that's already in the system. One that is under training in the colleges, in nursing schools and medical schools. What we have, or what you are talking about, is upskilling and reskilling of people who are already in the system, people like us who didn't grow up with computers and today now we have to use all that, right? So we have the IIMs and the IICs and, you know, IHMRs running small courses. Not enough, but they are starting. But
when we talk of courses, it has to be applied.
Yeah.
It has to be clinically oriented.
No, so but what we need to as a country do is every training institute in the country needs to really adopt this. So I'm going to now throw the questions to the audience. Actually, I want to welcome questions from the audience for frying both of you. Yeah, Dr. Anshuman, please. Yeah. And anybody else, because this would be the last 2 questions. I don't want to keep everybody waiting for too long. So
I have my director and the medical superintendent as well in the crowd.
Yeah. See, regarding acceptance of technology, there is a clear-cut research analysis of neuropsychology. Only 2.5% of the population are early adapter. I confess that I'm an early adapter of the technology. I bought mobile when it was 18 rupees outgoing, 9 rupees incoming. That was useless, but I adopted that. Similarly, when I was an MBBS student, ultrasound came into the scene, and we used to write ultrasound left and right, but my father, being a surgeon, he always used to tell, first palpate, why you are writing ultrasound? Today, can you believe any doctor who is doing palpation and not writing ultrasound? This is adoption of the technology. Similarly, our generation, they have reluctance in adopting any kind of screen technology, any kind. Similar happens with that. But what is the driving force? For example, corporate healthcare system, they adopt HMS in 4 phases. First phase only for billing and investigation. Second phase, HMS, just looking at the graph, Excel sheet, how patients are going up. Doctors ask, my motivation, if you want to retrieve my data at the end of year and publish a paper, how can I do? Corporate is not spending money on that. That will be driving force of the doctors to adopt. And now, post-COVID MBBS graduate, they are fully adopted digital technology. we need not to struggle for the new generation. Just we have to struggle for our generation because we have shifted from pen paper to digital.
Anybody else?
Hello, ma'am. Actually, digital technology is the need of the day. We have to adopt maybe today or tomorrow. Without that, you cannot function. Now, there are limitations in a government setup. My each specialty saying 200 से 250 patient. It's practically not possible, right? So we are trying to, motivate them, trying to make some system, trying to, do some innovations where probably startups can help, where, they can, modify the things such a way that it should be a more doctor friendly also, and of course patient. I also have worked in the corporate setup, not for long, 6 months. There also there is a problem. When you are actually digitalizing your prescription, there is no eye-to-eye contact with the patient. As a good clinician, they said, sir, कुछ भी करो, मैं तो नहीं digital में जाऊँगी, because मेरे को तो patient से बात करनी है, which otherwise half of the time पहले आप पूछो, फिर आप करो, again you keep asking. Patient also understands कि डॉक्टर साहब को कुछ आता नहीं है या type. So that clinical medicine actually मतलब is fading at some cost of this digitization. So that gap we have to see how we can fulfill by using various startups, because recently there is two IIT Mumbai graduate came, I think last week to me. What they are doing it कि whatever you are conversing with a patient, you have eye-to-eye contact, you do everything, whatever, like any other conventional patient you are seeing. Everything is being actually recorded, and maybe Hindi, English, both. And then they are converting that AI-based solution in a meaningful sort of a case sheet to the case record, which I was actually, but that need to be a lot of.
No, there are multiple, yeah. So there are multiple.
It is a beginning, probably. I think time will come that we will develop. So I think it is an excellent thing. We need to adopt the new system.
No, the largest challenge for at least the clinicians and the nurses is because the amount of data that you had to record has been so high that typing it or even taking it from a drop-down menu was actually challenging. But today, with what he was just mentioning, this is called ambient listening. So we not only have a speech to text, but along with the speech to text is also ambient listening, where while I'm conversing with you, it's all getting recorded, which is a great tool to have. And in the end, you just sort of sign off like what you do. Additionally, there is a doctor who has a startup he has a sensor pad on which you put your case sheet, and he just write it, and it gets transcribed into your EMR. So there are multiple newer data acquisition tools have come, which has made life very easy. The amount of accuracy is very high. Microsoft has also done the same thing for Dragon, which is, they have launched it last month. So there are multiple tools, and then they ride on AI layers and everything. So life for adoption by a healthcare provider has actually become very easy. Very easy. And it is also multilingual, and that whole multilingual program is happening at the Google office in Bangalore. They've got like some 14 languages that it can translate to. So in that sense, I think adoption as a challenge and doctors being resistant and all, that's a story of the old days. That's history now. We are all very much, into it. The only question is, when people who build hospitals, all the, suited, booted, lalabanias also, all of them who put the money, it is very difficult for them to understand the nuances of digital technology and how it impacts healthcare and how it actually is better for their P&L overall. They think immediately uska investment, wo return on investment, all that stuff. So putting money on digital infrastructure should not be looked at as a cost. That is what I want to say. It is your investment, just like your brick and mortar, and that is why I say that it is like your investment in infrastructure. Because if you do this, then only you will have good healthcare outcomes, and then only you will have a better P&L. This is a story that we need to tell, because most of us are not the people who invest in the hospital. So the people who put their money in the hospital must understand that digital is not just buying a few computers and doing a few softwares. It's far more than that, and that is the basis of delivering healthcare. That's the basic tool without which we cannot deliver healthcare anymore.
Yeah, I couldn't agree more with Dr. Anshuman, Dr. Gupta and yourself. So I think two aspects which I really feel are very crucial, which we've not spoken about, is the rise of medical legal issues. Because rise of medical legal issues and adoption, there is a correlation, and we wouldn't really talk about it, but I just wanted each one of you to really think about it. The second is, guys, whether we like it or we don't like it, it's the insurance which is the highest payer of making a hospital work and hospital to pay to the investors. So if insurance is on blockchain, if you are not on blockchain, you are out of the business, right? And the third is the cost benefit analysis of utilizing technology. You know, when you build it greenfield or whether you build it brownfield, it's very clear that the ROIs are super, right? It's just that, you know, like the way earlier they would not invest in CT scan and they will say, let's give it to some Lalaji to manage it and plant it because it's a different business model. But I think when it comes to healthcare technologies like HISs of the world, I think this is a basic start, and it's not an option. It is so important for your own sustainability and for your brand proposition. I think it's not anymore a choice, but it is compulsory that they adopt technologies if they were to stay put in the business. Otherwise, they're out of the business.
No, so about 25 years ago, we used to have these kind of discussions around quality. NABH had just been launched, 2004. And I remember the first 4 years. People would be same? Yes, at that time, quality as a cost versus quality as an investment used to be the discussions in most of the forums. And I think now, after 25 years, I'm still part of the forums, but quality has been replaced by digital technology. But otherwise, the discussion remains the same. Yeah, Rahul, you... Yeah. No, so we have the right things happening. We have ABDM happening. We have, you know, DPDP Act happening. A lot of things are happening in the right direction, so it will happen. So Rahul, I want a closing comment from you as well.
I'll be talking about the good part of the story. चीजें अडैप्ट कर रही हैं, but mechanisms बड़े अच्छे आ रहे हैं. For example, in state of UP, जब तक we were not the recognized incubator, in the evaluation committee which gives the government fund, none of the medical colleges were part of it. The day GIMS became an incubation center, in next week, we were made a part of every healthcare idea that gets funded from UP will get evaluated by this committee where we are also there. What we do, we get all the PPTs a day before. अभी 26 तारीख को मेरा एक सेशन है, तो 25th को I'll get all the PPTs. My job is to figure out कि किस department में भेजना है. We send all the PPTs to different departments to get their first-hand opinion. कि ये डिवाइस बना रहे हैं इस डिपार्टमेंट के लोग, व्हाट इज योर टेक? फॉर एग्जाम्पल आई टेल यू, एक माउथ गैग बन रहा था एक इंजीनियरिंग कॉलेज में, लोगों ने खूब सेलिब्रेट किया, वाओ क्या बना दिया, ये तो आईपी लेके आ गए. व्हेन आई हैड सेंड दैट पीपीटी टू माय डिपार्टमेंट एंड वन ऑफ माय ईएनटी फ्रेंड मेरे को बोलते यार ये देख, ये तो 2500 का मिल रहा है फ्लिपकार्ट पे, क्या नया बना रहा है. फिर उन्होंने मुझे बोला कि अगर तुम एक्सट्रैक्शन करते हो तो तुम्हें मैं कैमरा बीच में डाल दूँ, क्या तुम कैमरे में देख के करना पसंद करोगे या डायरेक्ट फील्ड में? मैंने कहा डायरेक्ट फील्ड ज़्यादा कंफर्टेबल होता है. मतलब दैट इज़ वेयर इनोवेशन को वैलिडेट कराइए. और अभी चूंकि इस तरीके से जब मेडिकल कॉलेजेस भी इन्वॉल्व हो रहे हैं अपनी बात रखने में, तो एब्जॉर्प्शन और एडॉप्शन बेहतर होगा. अब जो वो अभी हम ना ICMR का इंटेंट सेंटर भी है इंडिया में, मेडटेक मित्रा है, मेडटेक मित्रा पे आप जाओ, वहाँ से हमारे पास भी आएगा. तो अगर पब्लिक एंड प्राइवेट हॉस्पिटल्स जिनके पास ट्रायल कैपेसिटी है, अगर वो इस लेवल पे इन्वॉल्व होंगे स्टार्टअप के साथ, कल कोई अच्छा प्रोडक्ट निकल कर आ गया तो लोग यूज़ भी करेंगे. हमारा एक स्टार्टअप है बहुत सक्सेसफुल हो गया, उसने एक डिवाइस बनाई है मात्री, वो मेंस्ट्रुअल पेन जीरो करता है, उसका क्लिनिकल वैलिडेशन भी हुआ, हमारे यहाँ भी लोग यूज़ कर रहे हैं, लोग इंडोर्स कर रहे हैं. तो एडॉप्शन ओवरनाइट थ्रू रेगुलेशन ऐसे नहीं हो जाएगा कल से करना है. इट हैज़ टू कम फ्रॉम विद इन, और धीरे धीरे व्हेन वी को क्रिएट इट, दैट्स माई वर्ड फॉर द डे, वी हैव टू को क्रिएट टू मेक इट मोर अफोर्डेबल, एब्जॉर्बेबल, सो दैट्स द की.
But BAM, that will remain constant, whether it's a NABH, quality, digital, Now AI is coming.
Yes.
E-chaos, e-radiology, e-pathology, doctors are giving resistance to that. AI can't replace doctor, but that will come. This is a coming wave.
No,
This is
but
not a
AI
technology.
is not there to replace doctors. But
Exactly,
what
but
will happen is
doctor
the-
has become phobic.
So the
AI is not going to replace doctors.
Yeah, so
हाँ सर, लोगों का pitch line थोड़ा गलत होता है. AI will always and always be assistive. It will never ever be able to replace the skill which I have.
Latest robotic system has inbuilt AI. I am finding so comfort not going for CT scan to look at. It's visible inside the eye lenses.
So Dr. Anshman, it is like the doctors who don't use digital technology and AI will get replaced by doctors who use AI. That's all.
मैम
That's
इतना
all
अच्छा
that
एग्जाम्पल
happens.
है. Two
वही होगा और कुछ नहीं होगा. All these tools are, we make these tools to make our job easier, to make it more safer for the patient, and to actually augment our own capacity to do better clinical care. So I think on that note and on, I really liked the way you closed your note on working together, co-creation and collaboration, because that's the only way to go forward. And on that, I would like to close this last session. And thank you all very much. Unless you all have any questions for these gentlemen. I am anyway moderator. I'm not answering anything. Thank you so much. Thank you all.
Thank you, panelists, for this insightful session. Now, I may request Mr. Afzal Kamal and B.K. Rana sir to facilitate the panel. First, we have Dr. Uma Nambiar, CEO, Indian Institute of Science Medical School Foundation. Dr. Vishal Gandhi, founder and CEO, BIORx Venture Advisors. Dr. Rahul Singh Amritraj, Head Center for Medical Innovation, Government Institute of Medical Sciences, GIMS.